Hi everyone, it's Lauren. I am going to go over my clinical presentation with you all that I wasn't able to do 3 weeks ago because I had a baby. And now I am trying to hurry up and get everything done while he is with my mom. So I'm just going to go over my patient's chief complaint and review all his systems as well as review some of the articles that I read. And if you all have any questions, you can just email me and let me know. So my patient was a 28-year-old female. Her initials were LW. She came in. Her chief complaint was that she's been coughing up these white, smelly balls. She said she thinks they're coming from her throat and they're making her breath stink. So for subjective, the patient reports having increasingly foul-smelling breath over the past couple of weeks, as well as coughing up small white foul-smelling balls. She states that she has looked in the mirror and saw these small white balls in her tonsils, but did not attempt to remove them in fear that she would make herself gag. She believes that these balls sometimes dislodge themselves. She swallows and chokes on them occasionally, and she has attempted to switch her mouthwash to one with alcohol in an attempt to get rid of her halitosis, but so far nothing has worked at all. She denies having any pain at the current time, but may have an occasional sore throat that may last about 2 or 3 days. So as far as a review of her system, she states that she has not had any allergies at all, nothing to medications or to any type of food allergy. She is not on any type of pain medication. As I said, she hasn't been in any pain, so she wasn't taking anything, as well as prescription medication. She doesn't take anything. Past medical history was unremarkable. She just had slight anemia, but nothing serious. Past surgical history was none. Social history, she denies smoking, she denies drinking, except for an occasional drink, but nothing serious. She also states that her vaccinations are up to date. So for my objective, so she weighed 198 pounds. Her height was 68 inches. Her temp, she was afebrile, was 97.2. Her pressure was 132 over 68. Pulse was 84. Respiration 16. She was 100% on room air. And other than that, she appeared to be in a healthy white female. Did not seem to be in any type of distress or anything like that. So going over her systems, her eyes, her EOMs were intact, no hemorrhage, no drainage, perla. Nares, her turbinates were pink and clear. Negative, negative discharge. As I stated, she was not having any type of cold or anything like that. Tympanic membrane, her was within normal limits. The cone of light was present. No discharge or inflammation. It was pearly white intact. She just had a little bit of cerumen, but once again, nothing too serious. Her throat was a little bit red, definitely. Wasn't swollen at all. But she did, which was weird, had these small white pockets in her throat that had, it seemed as if some type of white particle in them. Once again, didn't really know what it was, but you can see that her tonsils had these pockets as well as these small white ball like particles. And her breath, she did have positive halitosis. Her breath was not the pleasant, which she apologized for. But she said that she noticed that the foul smelling breath occurred when these little white things occurred. Once again, not really sure what they were. But as traveling downward as far as systems wise, her lymphatic system was unremarkable. There was no cervical adenopathy. It was non-tender upon palpation. Her heart, regular rate and rhythm, no murmurs, no thrills. Normal S1 and S2. Lungs were clear bilaterally, all throughout. A negative cough, and she had no enlarged spleen or liver or anything like that. So as she's in the office, both my preceptor and I are just looking at each other like, what the heck? Don't know what this is. So, we type into Google small white balls in your throat and, just nothing, nothing that you would think would be a medical term because we had no clue what these items were. So finally, we found something called, and excuse my pronunciation because this is not going to be correct, tonsiloliths. essentially tonsil stones. So that was what came to be by our diagnosis for this patient: tonsil stones, and the ICD-9 code is 474.9. So what WebMD has termed this as are the tonsils have small pockets where bacteria and other materials, including dead cells and mucus, can become trapped. When this happens, the debris can become concentrated in white formations that occur in the pockets. These tonsil stones form when the debris becomes trapped or hardens or calcifies. These tonsil stones can cause bad breath, a sore throat, difficulty swallowing, ear pain, and tonsil swelling as well. So a little bit more about these tonsil stones from one of the articles that I read, which was from it's actually a dental magazine, or excuse me, a dental article. It says these tonsil stones are defined as structures that developed in the crypts of the tonsils that act as localized concentrations of both aerobic and anaerobic bacteria, progressing in calcification from soft gels to hard stones. They are often associated with tonsillar inflammation or tonsillitis, and this is believed to be due to the suitable environment that the tonsillar crypts promote for the activity of anaerobic bacteria in the upper airway system. A mixture of retained exfoliated epithelium cells, keratin debris, and foreign particles is accumulated, and eventually this formation takes place. And as far as the diagnosis, or so as far as the halitosis is concerned, they believe that this volatile sulfur compounds, such as hydrogen sulfide, methyl mercaptan, and dimethyl sulfide, are most often the culprits of halitosis, with hydrogen sulfide and methyl mercaptan accounting for about 90% of the total content of this volatile sulfur compounds. And most of these compounds are derived from the breakdown of sulfur-containing substrates such as leukocytes, epithelial cells, and food debris by microorganisms. So essentially, with these tonsil stones, you know, being leukocytes or epithelial cells in food, they're breaking down this sulfur, which is now excreting into her breath and causing this halitosis, which sounds absolutely disgusting. But other differential diagnoses that we had come up with were acute tonsillitis, which most often affects 3 to 7 year olds, and it is caused by viruses that cause the common cold, influenza, and Epstein-Barr virus, which can also cause mono. So when an infection occurs, the tonsils can swell and become inflamed and sometimes painful. And then our other differential diagnosis was gingivitis, which was obviously caused by poor hygiene, which she did not present with at all. I mean, she had perfect teeth. It was just her breath. And for a few days, as few as 4 or 5 days without oral care can initiate the infectious disease process, according to one of our textbooks. This disease process presents as an inflammation of your gums and may have areas of ulceration with or without purulent discharge from the affected areas. And patients will often report some bleeding with eating or while performing oral care. So as far as the plan for her is concerned, unfortunately, there really is no true diagnostic test that can be performed to either rule in or rule out this diagnosis of tonsil stones. It says that the diagnosis, once again back to this dental hygiene article, the diagnosis of tonsil stones can be made clinically based on symptoms and physical examination. These small tonsil stones are often asymptomatic. However, large concentrations may produce several symptoms such as halitosis, a sensation of a foreign body, and frequent irritation in the throat, which causes inflammation of of the tonsils. So she said, this patient stated that, oftentimes she only realizes, she only recognizes that these tonsil stones are present, or these little, as she kept calling them, little small funky white balls. They're only present because she feels a little bit of pressure in her tonsils. She feels like there's something in there, but she's not able to get it out at all, and not really sure why she can't get it out. And until she happened to look in her throat to open up her mouth and see that these little formations were there. And as far as treatment is concerned, um oftentimes there really is no treatment. Many tonsil stones, you may have many tonsil stones, especially ones that have no symptoms, and they really don't require too much additional treatment. So there's really not much you can do except for, continue to brush your teeth well and use a mouthwash to kind of get rid of the halitosis. But it's not much. If as I'll go into further detail what else can be done, but for the most part, not much can be done except for making sure that you keep up with the oral hygiene. This one website that I looked at, once again, is WebMD. They said that you can have some at-home removal, which says that some people choose to dislodge the tonsil stones at home using a toothpick or a swab. So I guess they have created some little device of their own that they stick into their tonsils to dislodge this stone. Now I don't know how pleasant that is, and I guess you'd have to kind of have a good gag reflex, or absent gag reflex, I should say, because I couldn't imagine how pleasant this experience might be. They also state that you can have some saltwater gargles. So it says gargling with warm, salty water may help to ease the discomfort of the tonsillitis, which often accompanies the tonsil stones. Antibiotics is another option. Various antibiotics can be used to treat tonsil stones. While they may be helpful for some, they cannot correct the basic problem that is causing these stones. And also, antibiotics have a side effect. It's not you. I mean, you may not. This is not necessarily going to be treated by this antibiotic. That's not really going to solve the issue. I guess the issue is finding out how to completely remove these stones from, where they are. And lastly, the last option is to have a tonsillectomy, surgical removal. When the tonsil stones are exceedingly large and symptomatic, it may be necessary for a surgeon to remove them. In certain instances, a doctor will be able to perform this relatively simple procedure using a local numbing agent, so that the patient will not have to go under general anesthesia. And back to this dental article, they actually said that they have, there was this mouthwash that they used, or that some patients had used in one of the studies, that was supposed to help, I guess, break down the bacteria more than normal mouthwash would. But it doesn't give a specific name of it, so I wouldn't even be able to. I don't know, how specifically how this mouthwash works. But once again, the other option is to have an elective tonsillectomy, to help remove this, because it is very, from what the patient was saying, it is very uncomfortable. It's not, and it's not all the time, but it is a very uncomfortable feeling, and knowing, on top of that your breath is not smelling the best because of this, was a bit upsetting to her. So as far as education is concerned, we just pretty much educated her on what these tonsil stones are and what they're made of, and why they have such a foul smelling odor. So once again, as far as the patient education is concerned, I wrote that the tonsils have small pockets where bacteria and other materials such as dead cells and mucus can become trapped, and when this happens, the debris can become concentrated in this white formation that forms in the pockets. Um, and I stated that why and how the stones cause this bad breath. Um, but as far as follow up for her is concerned, there really isn't much follow up. She can try to go to her what do you call it? Her dentist to see if there's anything that can be done, but from what I've read and from the articles, there's not really much that can be done as far as this concerned. But if it gets worse, or she felt as though her symptoms persisted, or she was having some ear, nose, or throat pain, excuse me, if she was having some difficulty swallowing, or severe ear pain, or some tonsil swelling, obviously that is an emergent situation that needs to be addressed right away. So A, she needs to go to the ED, or B, if she sees that it's starting to get worse, she would have to follow up with the ENT specialist to discuss having a tonsillectomy or discuss some other option, because not really sure. There's not really much that can be done on an outpatient basis, in the clinic. But that pretty much is her story. It was a very interesting one, and it was something that I never saw before. And as I stated, we definitely Googled this immensely because we never heard of it. So I will send you all my articles as well as my case study. Um, and if you have any questions, just let me know. Just email me. And I hope to see you guys soon. Take care.